Hi, my name is Robert Pearson from Central Kitsap Fire and Rescue. I am sharing this video today with you today as an aspect of the fire service that is saving lives around the country, and that is high-density CPR. High-density CPR utilizes many of the common aspects associated with CPR, such as chest compressions, ventilation, and patient packaging. So what is the big difference between CPR and high-density CPR? In standard CPR, the pause of compressions is given for ventilations, and then the chest compressions resume. During this time, the heart loses the buildup of blood pressure and the ability to move the blood throughout the circulatory system. Traditionally, two-person CPR would start with 30 compressions, followed by 2 rescue breaths or ventilations. In high-density CPR, no pause is given for rescue breaths. Thus, the preloaded blood in the system is never lost, and oxygen and blood are able to exchange simultaneously. This leads to better oxygenation of the blood and thus better outcomes for the patients. According to the American Heart Association in 2010 protocols, the goal is to minimize interruptions in chest compressions, provide compressions of adequate rate and depth, and avoid leaning on the patient between compressions. And we want to avoid excessive ventilation. So how does high-density CPR work? First, the patient is checked for responsiveness. During this process, you're going to be checking the patient to see if they are obviously able to respond to you, if they're breathing, and if they have pulses. Next, the patient's chest is exposed and the compressor begins to compress the chest at a rate of 100 to 120 beats per minute. And we want to achieve a depth of around 2 inches. Next, the ventilator attaches the BVM or bag valve mask to an oxygen cylinder and places an oral adjunct or supraglottic airway, and begins bagging the patient on the upstroke of the compression at a rate of 1 breath for every 10 seconds or so. So this is about 6 or 8 breaths per minute. No pause is taken during this process, and the process will continue for up to 2 minutes. At that time, the pair will switch positions, and an assessment of the patient for signs of ROSC will be observed. If no signs of ROSC are present, the compressions and ventilations both continue. As more personnel become available to assist in CPR, defibrillator pads are placed on the patient and cardiac rhythm will be assessed. This can either be done automatically on AED mode or by a paramedic on scene. Once indicated, the patient may be shocked. During this process, steps will be taken to prepare the patient for drug intervention and patient packaging for rapid transport. Upon transportation, we will be choosing the appropriate facility for the patient. Since my department has adopted these protocols, we have seen a significant rise in the successful resuscitation efforts of witnessed cardiac arrest. The strategies of fire prevention when it comes to high-density CPR include a program my department often refers to as our Resuscitation Academy. This is a free event that teaches high-density CPR to a large group of individuals. The benefit our community has already been made prevalent by the successful application of high-density CPR from witnessed cardiac events and rapid transportation, activating the 911 system. Thank you for your time. I hope you were able to learn something about the features and benefits of high-density CPR.